Hello, I'm United States Congressman Tim Murphy, and I represent the 18th Congressional District of Pennsylvania, which includes suburban Pittsburgh. Thank you, Gail, for inviting me to speak with you all today. I wish I could be in person with you, but I must be in southwestern Pennsylvania. Your hard work has already made an impact in California. In July, the Board of Supervisors of Kern County unanimously voted to implement Laura's Law, and the program will be up and running by this October, joining Nevada County. Further, Orange and San Francisco counties have voted to adopt and implement the law. It is being seen and discussed as both a humane and fiscally responsible necessity. Now, prior to serving as a member of Congress, I worked as a psychologist, and I currently serve as a commander in the United States Navy Medical Service Corps, treating returning soldiers with traumatic brain injuries and post-traumatic stress. As a psychologist with nearly 40 years of experience, I have first-hand knowledge of the need for and the help that's available for many of the families in the audience today. That experience also comes from my work in Congress. 2 years ago, I started an investigation as chairman of the Oversight Subcommittee into our nation's broken mental health system. As part of this review, I've heard from thousands of families who called and wrote and emailed me describing in painful detail how the mental health system has failed them. I'm sure you have heard them as well. Stories that too often end with families unable to get treatment for their loved one before tragedy. That's the overriding theme about our mental health system. It doesn't respond until after a crisis occurs. Now, it has been more than 50 years since we have attempted any significant reforms. But today there are 4 million people with a serious mental illness who are not in treatment. On average, 110 weeks pass between the first onset of psychosis and the first treatment. 40,000 people die by suicide each year, and there are more than 1 million suicide attempts. And each day, sensationalized headlines about violent episodes grab our attention and boggle the mind. On this just last July 23rd, a 59-year-old man entered a movie theater in Lafayette, Louisiana, killing 3 people, including himself, and leaving 7 others injured. It has been reported that the perpetrator had a history of mental illness, arrest, and violence. Tragic episodes like this are difficult to comprehend because they were so seemingly preventable. Why wasn't he in treatment? Can you imagine if we told someone with diabetes, your blood sugar is too low, but we're going to wait until you are in diabetic shock before we give you insulin? Or what if we told those with heart disease to come to the doctor only after they had a heart attack? We never deny care to those with chronic illness because their condition isn't sufficiently severe, nor do we walk away from an Alzheimer's patient simply because he or she cannot articulate their need for treatment. And yet, for families in a mental health crisis, this disconnection between symptoms and timely treatment plays out every single day. Those with a deteriorating brain disease, incapable of making informed choices as a result of their illness, are told they will not receive help or treatment until the patient attempts suicide or homicide. Too often, a person with serious mental illness encounters not a treatment, but the judicial system, where an uninformed judge says it's not illegal to be crazy and sends the person on their way. Well, it's not illegal to have a heart attack, but do we send them away? To help these people and families who are trapped in a system that is misguided and in denial, we must approach serious mental illness as a medical emergency that engages the community. That means we must accept that mental illness is a brain disease. It is not an attitude. It is not a lifestyle choice. Psychosis and schizophrenia disrupt brain functioning and result in disturbing behaviors. It is not a condemnation or criticism of those with severe brain disorders. It is acknowledging the facts. Hallucinations, voices, and paranoia prompt actions that aren't grounded in reasoned choices. When we accept that behaviors are symptomatic of what is occurring in the brain, we can address them without judgment, just like other medical diseases, and offer life-saving treatment before tragedy strikes. And that's the goal of my bipartisan Helping Families in Mental Health Crisis Act. This legislation removes the barriers that prevent well-meaning families from helping loved ones in mental health crisis. This bill also fixes the shortage of psychiatric hospital beds. It clarifies and simplifies HIPAA privacy laws so responsible families can be part of the care delivery team. And it makes major reforms to federal efforts so programs adopt research-based treatment models for individuals with serious mental illness. As a Government Accountability Office report requested by my Energy and Commerce Subcommittee on Oversight and Investigation revealed, our federal mental health system is dysfunctional, disjointed, and without effective leadership. Do you know there are at least 112 separate federal programs supporting individuals with severe mental illness scattered across 8 departments, and there is little to no coordination across these programs. For persons with physical disabilities, we adapt mobility through wheelchair access, ramps, and sidewalks. But for those with mental illness, we make it the most difficult for those who have the most difficulty. The administrator of the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, which is the agency responsible for coordinating efforts, told my committee and the Government Accountability Office that she saw no need to improve or work together. This is a clear example of unaccountable government, one that refuses to recognize its failings even when it is presented with constructive recommendations for improvement. We are not talking simply about wasted dollars or program inefficiencies. We are talking about lives ruined, dreams shattered, and preventable tragedies. Each day, we wait to pass this bill. An estimated 230 people die from suicides, drug overdose deaths, and the slow motion deaths which we can't even count. Those who have a mental illness and ended up homeless, or of a chronic co-occurring illness such as diabetes or heart disease. In fact, people with serious mental illness tend to die 25 years earlier. I will not stand for this deadly status quo. The Helping Families and Mental Health Crisis Act would fill the leadership void by creating an Assistant Secretary for Mental Health and Substance Abuse Disorders, an idea that has been promoted by both Republicans and Democrats. This doctor, who would have clinical and research experience as a psychiatrist or psychologist, would be responsible for coordinating these disjointed programs as well as evaluating and monitoring programs to ensure they work using evidence-based research and bring accountability to mental health and substance abuse parity. Our nation continues to mourn the lives of Macy Breaux and Jillian Johnson, buried just a few days ago by their families and friends in the aftermath of the horrific killings in Louisiana. Like we do for so many of these tragedies, Congress held a moment of silence to convey our respect and our prayers. But we need something beyond moments of silence. We need action. Let not our offer of comfort be mere silence, but let it move us to comprehensive action. Now is the time to provide hope to families and their loved ones. Now is the time for treatment before tragedy. And that is why I will not rest until we pass the Helping Families in Mental Health Crisis Act. So thank you all for the work you are doing to bring mental health treatment to those who need it most. Thank you for your support and tireless efforts. You are the ones who can bring this illness out of the dark shadows of ignorance and despair and into the bright light of hope.